So what kinds of things is Providence going to do here, and how will it impact patients?
Well, Emily, it's great to talk to you again. Well, we'll be bringing Microsoft's cloud and AI tools to Providence St. Joseph Health across all 191,000 of their employees and all 51 of their hospitals to improve clinical outcomes and improve the day-to-day working experience of the caregivers. It's really intended to bring much more data and data intelligence to the people that matter.
So let's talk about some specific examples. There's an example in our Bloomberg News story about this partnership, about a knee surgery in particular, and how you and they can use data to get a better handle on what works and doesn't work. Explain that.
Oh, that's really a great example to bring up, because it was one of the examples that really impressed me the first time that we really went deep with Providence. If you look across all of the, say, arthroscopic knee surgeries that Providence has done over the years, you find tremendous variations, sometimes as much as a 10x variation in the satisfaction that patients have with the outcomes, and a 200x variation in costs. And if you plot out all of the data that went into each one of those surgeries and start to go deep using machine learning and AI, you start to discover clinical pathways that allow you to optimize and give clinicians decision support to produce the best possible patient satisfaction at the most reasonable cost.
Now, the healthcare industry has been notoriously slow to adopt new technology. I mean, it can be impossible to even send your doctor an email, for example. What has been holding the healthcare industry back from embracing technology like, say, Microsoft's technology, and how long is that going to take to fundamentally change?
Yeah, I know it seems slow and it is frustrating, but in fact, it's hard to remember that actually just 15 years ago, less than 15% of our health records were in digital form, whereas today, almost 100% of digital health records in the United States are now in digital form. And that gives us a foundation for just a lot of possibilities in extracting insights from that data. And so it seems like it's slow, but we're now at a place where we have this wonderful digital foundation, and this is exactly the foundation that Providence and Microsoft want to build on today.
So let's talk about the possibilities. How will the cloud in the future make my experience as a patient, for example, vastly different?
Well, one of the projects that we're doing with Providence in this partnership agreement is we're going to look across all of the electronic health records for all of Providence's patients that are undergoing treatment for cancer. And hidden in all of that kind of text and unstructured data are patterns that might lead to insights, earlier diagnosis, and better treatment possibilities for those cancer patients by integrating across all of that data. Right now, that data is siloed across dozens of different data systems that have been collected over the years. By bringing it all to the cloud, and then using not only Microsoft's Azure cloud, but also Microsoft 365, so that caregivers can collaborate with each other on those discoveries, and on Dynamics, so that the operations of Providence then can be managed all in the cloud, gives the possibility to go really at scale across the entirety of Providence's health system.